Welcome to Blissful Consults with yours truly, Dr. Cammy, a PhD licensed psychotherapist with special training in trauma-informed healthcare. Monica from California wrote in with a question about how to find a therapist among a sea of professionals with various backgrounds and credentials. Dear Dr. Cammy, I've finally decided to get some help with my anxiety. I started my search and I'm completely and totally overwhelmed. I don't know the difference between all these professions. I've looked through lists that include people with MDs, PhDs, LCSW, LMFT, MA, and so many more. Then there are all the life coaches, energy healers, and Reiki masters out there. And that is only the beginning of the list. How do I decide what type of professional I should work with? Monica. Hello, my name is Dr. Cammy, and I am the founder and president of Bliss in Being. We offer cutting-edge psychotherapy and coaching for people who are ready to heal from the effects of chronic stress and trauma. I can personally help you move from the brink of burnout to holistic thriving. It's time for you to finally enjoy the life you've worked so hard to build, and I'm here to help you make it happen. When it comes to seeking mental health experts, there are a ton of options out there. There are psychologists, psychiatrists, clinical social workers, psychiatric nurses, and more, all of whom are capable of treating mental health issues. Regular diagnoses are also made by primary care doctors who may prescribe medicine or refer you to a mental health professional if they need an expertise in a particular area. So speaking with your primary healthcare practitioner, commonly referred to as the primary care doctor or PCP, is one of the best ways to start the journey. Your primary care physician might inquire about your symptoms and then they're going to do a physical exam. If they suspect that you have a mental health disorder, your primary care will create a treatment plan for you. This plan might include medication and a referral to a mental health specialist. You can always start with your PCP and then you can move forward from there. Some doctors' offices even have behavioral health providers integrated right into the practice, so you could get both at the same time. Licensed mental health providers, like all those you listed in your question, are trained in treating mental health conditions like depression, PTSD, anxiety, and more. If your PCP suspects that you have a chronic or severe mental health issue, they may recommend that you see a mental health specialist for a professional evaluation and then continued treatment. If your doctor does recommend more in-depth counseling, I would suggest consulting with several experts before you decide. So when selecting a mental health expert and a form of treatment, there are some things that you might have to consider. If finances are a make or break for you, that's got to be your first step. Search based on whether the provider takes insurance or if they have payment plans. If someone is not licensed in the mental health field, insurance will not reimburse them. If you fall in love with a provider who doesn't offer insurance, you could consider funding an HSA, a health savings account, and or asking the therapist if they do payment plans or a sliding scale. The next question to consider is, what are the top 3 skills you need in this provider to help you get better? Can the chosen mental health provider prescribe medicine? If not, can they recommend a doctor or a pharmacist or psychiatrist if you require medication? Do they focus on treating adults, children, or both? Do they have any experience treating problems like obsessive compulsive disorder, depression, or anxiety? What qualifications or training do they possess? And what treatment method do they employ? I always recommend finding someone who has expertise in at least your top 2 concerns. You might also want to confirm if they offer online counseling for mental health. How would they assist you in resolving an issue? How long would it take until you can anticipate feeling better? What happens if you don't feel better within the expected time frame? How do they handle that? There are many specialist categories that you can pick from. For instance, professionals with a license to practice psychotherapy include psychiatrists, psychologists, social workers, and other counselors. Non-licensed professionals are people who typically have a master's degree, but are not necessarily licensed because the state neither offers nor mandates a license in that particular mental health sector. You could also encounter providers in what's called an unregulated field, like Reiki or life coaching. And there's no requirement for formal education, but that person could have a tremendous amount of life experience and have accrued a lot of certifications in their chosen field. A layperson specialist, like those providers in unregulated fields, have often helped others and recovered from mental health problems themselves or had someone really close to them who they helped recover. Different states have different laws governing the practice of psychotherapy. So, as a result, I would really suggest that before starting therapy, inquire about the credentials and the training of the person you're talking to. Long story short, all scientific evidence points to one single factor as the biggest predictor of clients getting better from mental health issues. And that factor is the relationship between the client and the therapist. All that to say, if you narrow your search based on experts for your particular issue and they all fit your budget, your best next step is to pick the one you feel the most connected to and go for it. You may also need to consider securing a provider to prescribe you meds. If your PCP is unable or unwilling to prescribe, that means you will be on the hunt for a psychiatrist or a nurse practitioner. Psychiatrists and NPs are doctors and nurses who specialize in detecting and treating mental health issues. A psychiatrist or NP is a type of medical professional who, in addition to offering therapy, can provide prescriptions. If you're wondering why not just choose a provider who can provide the meds and do the therapy, I can offer a couple of reasons. First, if you do find someone you love who does both, more power to you and hold on to them. But most of the time, professionals who can prescribe medication do not offer therapy. And if they do, they might not be a great fit for medication, or they may be a great fit for medication, but not a great fit for therapy. Thanks to telepsychiatry, if you'd like to receive care in the privacy and convenience of your own home, instead of speaking with your primary care physician about a referral to psychiatry, you can virtually visit an online psychiatrist or other certified specialists for an assessment. If necessary, you'll be given a unique treatment strategy, which can involve taking medication, which will alleviate some of your symptoms. Ultimately, the name of the game is building a team that works for you in cultivating your long-term health and wellness. Make your list, do your interviews, and always listen to your intuition about who's the best fit for you.